Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Ovarian dermoid or the teratoma. So what is this? This is ovarian dermoid and the teratoma. This is a slow-growing tumor containing the elements from the multiple germ cell layers. It contains the fats and also the calcification. There is the fat which appears, and this is nothing but it is dirty black on the CT, and there is also the calcification which appears white. It can undergo the torsion, can be seen on USG. It is very hyperechoic. There can be the tip of iceberg sign as well as the posterior acoustic shadowing. There is hair plugs. The hair plugs is nothing but the dot and dash sign. Also the Rokitansky protuberance. To learn and grow daily like this, please do subscribe.